Hello, we're back for another Myo Munchee live. Just let it roll on in. Hello, welcome. Welcome to our Myo Munchee parent lives Q&A. So we've been running a few of these. I am Kelsea Green. I'm a speech pathologist, orofacial myologist, Myo Munchee clinical advisor and parent advisor, as well as a mum. So I will have been hosting these for a few months now, but we are taking a deep dive into those early milestones. So continuing on from our chat last fortnight with Dr. Mary Burke, we had a few questions come up, so we're really going to focus in on those ones that were sent in after the chat, as well as any that you have today. Pop them in the comments and I can hopefully cover them. This is just a snapshot. If you do have any deeper questions that you want, reach out to the team, and we're always more than happy to help. So yes, we're going back to those milestones. We're talking about sucking, chewing, teething, to progressing to the mature swallow pattern, drinking from a cup, swallow, chew, swallow, breathe mechanisms, and just when all this should be coming in within that first, 6 to 12 to 18 to 2 years. So those big milestones that happen in that first 2 years of life. So I'll jump into the questions we had after last fortnight's chat, and then we'll go forward with some that pop up today. So first one that came up was around the first milestone we spoke about, which was sucking. So it was my baby pulls off and on while feeding. So we were guessing breastfeeding with this question. Does it mean they're not sucking right? Now my big one is that pulling off can mean lots of things. It's not always just the naughty behaviour or distraction like we get told. It can be a difficulty maintaining that suction and that suck skill. But I'm not an IBCLC or an international board certified lactation consultant. I have a lot of training in this area as an orofacial myologist and with lactation training, but I would say if this is persisting past and it's getting really frustrating, and you are concerned that it's more related to the suck, contact an IBCLC, a lactation consultant. Jump on our website and look for a lactation consultant trained in a Myo Munchee, and because they'll be looking at more of that orofacial myofunctional disorders and dysfunction with the lactation lens. So I think with that question, like why is my baby pulling on and off? Is there disordered suck going on? Quite possibly, but there could be many, many reasons. So there could be that difficulty maintaining the suction. So whether there is some lip or tongue dysfunction or airway congestion or just tension patterns. But the best thing to do in those early phases, particularly if there is that ongoing clicking sounds or leaking milk or poor weight gain, we do want to make sure we are getting a professional to check that. The other one that came through was, when should I start offering an open cup for drinking? And what kind of cup is best? So this is certainly where I sit. So I mostly see kids and babies from about 6 months as we bring in those solids and drinking. So cup drinking, bring it in from 6 months. So as you're introducing those solids and the spoons and all the utensils and water starts being introduced, then use an open cup. If you don't need to worry with the other things, a straw and an open cup are just the best for that oral development. So when we are introducing during that time, that's where I would definitely start. So yeah, little bits, maybe in the bath if they're sitting up, and I think that's the sort of things we are looking for. The same sort of things we're looking for in starting solids and starting our food adventure. If you're a mother, it's not quite the adventure you always think it's going to be beautiful and wonderful, and we love food, but it's just a mess. But making sure your child is stable is my biggest key, and that is the same if we're doing open cup drinking. So I'll jump back here. Where on the top shelf. Okay, so best cups. Manageable cups is what I always tell my clients. So your babies are small, they have small hands, let's think about that. I love this little egg cup. It was actually an Easter egg cup. And it was just perfect size for my little one. Fill it up with water, and she was easily able to handle that and manage the amount of water that was in that. And then this one is a great, it's a bit bigger, so it's almost a little step up, and rounded for the hands. It's silicone, so it's soft and they can manage it easily, lift it. Thinking that too, lightweight cups, so we don't want them to be heavily lifting or having to lean their heads forward. It needs to be manageable and to be brought up to their mouth as best they can. I love teaching cup drinking when they're in the bath. And yes, we don't want them drinking that much bath water, but it is a really great time. It's limiting the mess as a parent and just giving it a go. So offering them cups at bath time or water play time is just the best to get that introduction of a cup. Now they're not drinking it. We don't need them to be having big intake of water before 12 months, but introducing cups and things around that 6 months with other food is wonderful. I could talk about cup drinking all day, so I'll stop there. I won't rant on it about too long. But our other question too was teething. Yes, we touched on teething last fortnight, and it just seems to throw everything is what this question says. How can I support my baby through this phase? So lots of different ways to support our baby. And I remember my daughter started teething at 4 months. So that was like, whoa, I thought we had more time here. And broke teeth through just after that. It does affect a lot of things, and if it is affecting a lot and overwhelming you, again, reach out to a professional. There is incredible sleep nurses or even lactation consultants. Just when we're feeling like that's, teething is feeling unmanageable, then reach out to someone and ask you and trust your gut as a mum. But I feel during that time, those safe, firm pressure options, so things to chew on, like a Myo Munchee, like the baby, gonna make a big mess, like the baby, during teething, so they can chew on the sticks. I have my little pram attachment on. These are great. So baby in, chewing the stick can be great for teething. I always talk about long teethers and chewies, okay? I even start with teething, really stimulating those gums. Just the pressure on the gums feels great. We can also work so that using long teethers, also if they're around that 6 month plus mark and you're introducing their spoons. My daughter loved this one. She took it everywhere like a teether, but it is actually one of those first spoons, sensory spoons. So I guess finding those long ones that can go in their mouth are best for that oral stimulation, strength, to help with the teething. Also feel like during this time, so the question is, it's throwing everything off. So how can we support it? Well, teethers like the Munchee, like all your other pieces that I just showed, but also maybe having a look at, I like some food teethers. So we did a lot of frozen pineapple cores, and especially once we've got food introduced over 6 months, it becomes a bit easier. Mumsicles, if you're breastfeeding, I froze breast milk into a little teether and she would chew on that, and it was so soothing to the gums. And I just think, offering them that cool things to chew on, as well as a bit of pressure of something to chew on, is just great. So I'm just checking in, keeping things in cooler temperatures for them. Also, just lower expectations during that time, during some of the breakthrough of those teeth, and particularly on the first ones, that they haven't really experienced pain like that, most babies. So it's new, and just going, okay, we're just going to have lower expectations. I remember we were like, oh, we're not going swimming today. Or, we just weren't going to get out the door as quickly because, we just want to make sure that they're comfortable and that we've got those goals going on. But we spoke about last week how teething is not just about the teeth, but it's part of that baby's oral development. So every phase, like teething, brings that new opportunity to build healthy oral habits. So bringing in their toothbrushes stimulation, bringing in their chewing, bringing in the munchie at these phases, that will actually give them relief and make them feel good. Okay, so they were our 3 big questions that we had after last fortnight's chat, but I'm just going to jump back to the top. I think we had a few questions come in, so if you have any questions about that, open cup drinking, teething, sucking, let me know and I will. Okay, we had another one that is about would this help with tongue posture, and what are your recommendations for frontal lisp? So yes, I was going to focus in on our early milestones today, but I'm more than happy just to answer a few around our older kids, because we did actually have some other questions coming in about our older kids, so I can jump into that if that's where we want to go. So helping with tongue posture and recommendations for frontal lisp. So yes, I do believe that Myo Munchee is one tool that can support that tongue posture. But if things persist and that tongue posture with compliance and commitment to using a munchie, you might need more than just a munchie. So it's a part of my program with tongue posture programs, individualized programs, and also recommendations for frontal lisp. Well, I do believe it comes back to that tongue rest posture. So if our tongue rest posture is low in our mouth or between our teeth at rest, we're probably not going to get it up just for that S sound. So thinking about, can we correct that rest posture throughout the day, their swallow posture and their speech postures, to support that generalization. So recommendations for frontal lisp is that I would see a speech pathologist and or orofacial myologist, trained speech pathologist, because they will be able to support the oral motor skills that are needed for that lisp. So a lisp is when the tongue S, for example, is made with the tongue between the teeth. So it has our sound, for those that don't know. So yeah, it does often come back to that tongue rest posture. So hopefully that gives a little bit of an insight, but I believe frontal lisps that are persisting do require support and intervention. So a Myo Munchee is a great place to start, but I would seek out a speech pathologist in your area with orofacial myofunctional training. So jump on the website, the Myo Munchee website, and look for a practitioner in the area. If they're trained in Myo Munchee and a speech pathologist, they're more than likely got those skills in orofacial myology to support the frontal lisp. Okay. How to stop drooling, keeping the tongue in. So Myo Munchee again is a great tool for stopping drooling or supporting to reduce drool and saliva production, and to keep the tongue in. So when we chew on the Myo Munchee, I might just grab a bigger one because it's easier to show. So we have, stopping drooling is a big one. We're going to do a whole session on oral dysfunctions, dribbling, drooling, pacifiers in a few weeks. So join us back then, because we will be talking all about that dribbling, drooling. But keeping the tongue in, I guess, like I said with the lisp, a munchie is a great tool to start with. So when our teeth sit in the munchie, our lips are closed over top, our tongue will be reaching for the tongue attractor. So when we are doing that and we are chewing, we are building those muscles, the lip muscles, the cheek muscles, and lifting the tongue up to promote that swallow that allows us to manage the saliva. So saliva is necessary, saliva is good, but we need to, as a first step, maintain that lip seal and correct swallow and frequent swallow to manage the saliva. So lots and lots of different tools can be used to keep the tongue in if it's persisting past, if a munchie isn't enough for some kids, which is not. That's why I have my job. I'm an orofacial myologist and speech pathologist working with kids who have drooling and their tongue out at rest. So I wouldn't have a job if it was as easy as just to keep your tongue in. But yes, so I think munchies will promote a lot of saliva, to be mindful of that, but then they learn to manage it, and the strengthening of the muscles around the mouth will allow it to manage that saliva better. So hopefully that helps, but we are doing a focus in on drooling and oral dysfunction in a few weeks. Yeah, so is a 6-month-old thumb sucking to self-soothe sleep a concern for the development of the mouth? Look, sucking habits can be. Persistent sucking habits are something that we need to be aware of, and we do want those sucking habits, we touched on it last fortnight, to start reducing between the ages of 6 to 9 to 12 months. So sucking moving to chewing in that time. I think if we have a thumb sucking habit, bringing in a BB munchie as early as you can. These are only through practitioners, so finding a practitioner in your area to help you buy one of these is best. But yes, so I think it's a concern for the development of the mouth if it keeps going, or if there's a reason behind it. So sometimes thumb sucking dummy habits are just for that self-soothing. It is just something they've gotten used to in their life and familiar with, but if it persists, it could be airway related, so they're actually using that thumb to open their airway more when they're breathing and settling, due to ties or tonsils or adenoids, airway difficulty. So just always keeping an eye on whether that thumb sucking habit continues, and I would just be getting them onto a BB munchie as early as you can if they've got the thumb in there, then making sure we're also promoting that chew and those oral muscles moving away from the suck and supporting our lip closure and oral development around, so we're not growing our teeth around our thumb is something we talk about in clinic. But yes, I would get on a BB munchie for our 6-month-old thumb sucker for sure. When will we talk about the drooling session? I don't have the dates right here, but I believe we're doing these every 2 weeks. We are either doing our focused interview session where we really deep dive into sort of like the more detailed information, and then we're doing a Q&A the following fortnight. So stay tuned to our stories. We'll definitely be promoting which one. It's either next fortnight or the month after that. So but I don't have the exact dates in front of me, so sorry for that. Okay, any tips for getting an 18-month-old interested in the munchie for the first time? Just isn't interested in even holding it or chewing. Okay, I would be promoting chewing in just general ways. Does the 18-month-old put things in their mouth, explore their mouth? Is the mouth fun? Start there. But I do a lot of, first, have one myself if mine's in. I know my daughter was more willing to use her munchie once I had my munchie in. Big part of it is being consistent, offering it, having it in their life, having it around them, just by exposure, having it beside their bed, having it at the sink or the bath or something like that is a really, really just consistency. Having it in their life is a great place at that age. Sometimes I did with my when I like really little ones, or it's a fun little spoon. So I might do some sensory play. I might get some yogurt, and we make sure we rinse our mouth out and brush our teeth. Don't let the dentist hear me say this, but popping the munchie in with something delicious on it could be a good place to start. Or jumping on the website, YouTube, and you can have a look at munchie moves, and there's a video, a 5-minute clip of other kids with munchies in their mouth. And I think that that's really powerful, seeing other children or your family with a munchie in their mouth. Okay, I'll take a few more questions. Okay, 4-year-old really struggles to keep lips closed around the munchie. Any tips? So, look, my big thoughts around if we have been using a munchie with compliance and or consistency, like I was just talking about, and we're not seeing that progress of the goals that we want, like keeping our lips closed around it, we might need to reach out to a professional and just look a little bit deeper. Why are those lips not coming around the munchie easily? There are lots of reasons, whether it's about the muscles or lip ties or even cheek ties. So I had a little guy in the clinic this last week that was rejecting a munchie. He'd been prescribed it by someone else. They came to me, and yeah, he did not like this munchie. Once I had a look in his mouth, I found 2 very significant cheek ties, buccal ties, and when he put the munchie in, they were pushing on that munchie. The munchie was pushing on those ties. It was really uncomfortable for him. And so I was like, fair enough, he doesn't want to close his mouth around this. That hurts. So there's a bit we're going to be doing. But yeah, there's just sometimes we need to look a bit deeper. It might not just be as simple as picking up the munchie and popping it in your mouth. But keeping those lips closed around it also could be whether the airway is clear. Can they actually breathe through their nose? So if they can't and they feel that's blocked, they'll feel uncomfortable and they won't be willing to close their lips around it. But keep trying. I think, especially if they've had airway clearance, and you know that they can breathe through their nose quite well, I would, just keep persisting and using it passively, I guess. So working on maybe they aren't ready to munch it, so moving their teeth up and down and munching, they might just need to do some passive use where they pop it in and squeeze their lips closed and open. They might need some other OM exercises to actually support their lip muscles and development to be able to close around them without the stress. So we'll often see the mentalis, the muscle in our chin, engage when we close our lips, and we actually want, that wasn't a very good example, but everything just to come nice and gently together with minimal to no muscle engagement or visible. So we actually need to engage this top lip. But yeah, I would just check things out too. If you are pushing on with a goal and it's not making the progress, if we need support, that would be pretty clear. I use the parent checklist though that's on the website. It's really great to just keep an eye on the things that you purchased the munchie for at certain different dates, and you can keep an eye on, 2 months ago, 6 weeks ago, whatever it is that you've decided to, he was doing these things, now he's doing this, or we actually haven't achieved that. Okay, I'll have a look at it again in another few weeks. Still not doing it. Okay, it might be time to find a munchie practitioner. Is an appointment needed to get a munchie for 6-month-old? It's meant to be purchased through practitioner, so it depends where you are in the world and who can help you. But again, I would jump on the website and find a practitioner in your area and reach out to them directly and how they set up their way. But yes, our BBs are meant to be purchased through practitioners. Okay. Yeah, I think that's all. Great questions today, everyone. Thank you very much. And like I said, I'll be jumping on in 2 weeks' time with another guest to do a bit of more of an interview style, and we can chat about more of these early oral milestones and using the Munchee. So I hope you have a great day, and I'll see you in 2 weeks. Thank you.